Hi, I'm Colleen Adams. I'm a certified specialist in orthodontics, and I've created this video to go over some of the information that we give you when you're about to start orthodontic treatment with us. We go over lots of information, so we thought it might be good to have a video to just have as a reference so that you can go back and refresh your memory as to what we talked about. Successful orthodontic treatment depends on a partnership between the patient and the orthodontist. And in order to have a great partnership, we need to understand what the expectations are. So I'm going to go over all of the things you need to know about orthodontic treatment. We have probably gone over this risks and limitations sheet with you, and this is what I'm covering today. So, as with any medical treatment or dental treatment, there are risks inherent in treatment. Most of the risks for orthodontic treatment are either very small, very unusual, or they're controllable risks. The controllable risks, though, are more within your control than mine for a lot of them, so we need to really make sure that you understand what those things are. So the first one on my list there is talking about the biggest risk for most people. So the biggest risk for most people having orthodontic treatment is risk of cavities and gum infections. And in terms of cavities, we usually show you a picture like this. And this picture is showing these white marks on all of the teeth. And those white marks are where the enamel of the teeth has turned chalky white, and it is the beginning of a cavity. So if that progresses further, that chalky white enamel flakes off and you get a little hole in the tooth. That's a cavity that needs a filling. So these white marks are not something that we can fix without putting fillings in the teeth. So ideally, we want to make sure that's not happening at all. Most commonly, that area of we call decalcification, that white mark, is going to happen between where braces are sitting on the teeth and the gum. So the way that you brush your teeth is really important with braces. If you position your toothbrush the way that you normally would on the tooth, just in the center of the tooth because you're getting ready to brush your teeth, you're going to sit it right on top of the braces. That gets the braces clean, but it doesn't get the toothbrush bristles right down on the tooth so that the tooth gets clean. So you need to position your brush up above the braces and underneath the braces to get the teeth cleaned, okay? So all the way around up above the braces means that you have to stretch out your lips and your cheeks a little bit in order to get that brush up there. If it doesn't feel a little bit awkward to get that toothbrush up there, you're probably not getting all the way above the braces, okay? Same thing applies in the lower arch. You need to get that toothbrush underneath the braces. Between the brace and the gum is the area that the plaque starts to accumulate the most, okay? And then of course above them as well, okay? And then of course still the inside and the biting side like you normally would for your brushing, okay? Flossing is the other part of maintaining clean, healthy teeth. And if you go to floss the way that you would normally floss with braces on, you're going to find that the floss can't get all the way down because the wire will get in the way. You can attach floss to a floss threader like this. This will allow you to put the floss underneath the wire, okay? So you just take it like this and you're going to tuck the floss up underneath the wire and pull it right through, and then you can floss the way that you would normally floss those teeth. And then you're going to pull that floss right through and go to the next spot. And you're going to do the same thing. Pull it right through and floss like this. Okay? And you just keep going all the way around. Okay? This is a little bit technique sensitive. It takes a little bit of extra effort and time to get that floss in between all of the teeth. Okay? But it's a very good way of cleaning. We have taken to giving people these water flossers because the water flosser has been shown to be as effective as string floss, and it is faster and easier, and so a lot of people are liking it a lot. What you do with this is it recharges, so you just unplug it from the charger, fill it up with water, and then you're going to take the little tip and put it in your mouth before you press the button. When it's in your mouth, what you're going to do is you're going to take that tip and you're going to run it right along the gum line like this and have it shoot the water right in between the teeth. Okay, just trace along the gum line like this. Yeah, and then you go all the way around, and then you're going to do the same thing on the inside and bring that tip and feel the water shooting right in between the teeth as you trace it along the gum line. Okay, so some people find that this is a great help for them. Other people find the water stream from this a little bit too intense, in which case they can floss with a string floss. So either way is very acceptable, but we need you to floss at least once a day. So you're going to brush twice a day and floss at least once a day. Okay? Also in the little kit that you get is this little brush. So some little brush that looks similar to this. I usually suggest people try and keep this little brush in their pocket or their bag, because you will find that when you're out and about eating with braces on, food gets stuck in between the braces. This little brush you can use to just tuck right underneath the wire like this and get any food out that might be underneath there. Okay? Also, if you're brushing above the braces and below the braces, sometimes underneath the wire, right at the side of the brace, there's a little area of the tooth there that doesn't get cleaned very well. So make sure that you get that little brush under there once a day, just to get that side of the brace clean, so we don't get any little white marks there either. Okay, yeah, very useful little brush. Okay, so those are the things that you need to know about keeping braces clean. Also, if you're wearing Invisalign instead of braces, you still need to brush and floss the way that you would normally brush and floss. You're going to take your Invisalign out, brush and floss all of your teeth. You can use the string floss or the water flosser, both are great. The Invisalign itself also needs brushing, so you want to make sure that you brush the inside and the outside of your Invisalign trays, because they will pick up lots of plaque as well. Okay, and the little attachments that are on your teeth with the Invisalign, the little bits of white filling material that we put on there, you can brush right over those. Okay, you don't need to brush specifically around them, just brush right over them. Okay, so that's for Invisalign. The other thing that I usually mention in terms of looking after the teeth for cavities is that you also want to be aware of the amount of sugar that you're getting. Try not to have too much sugar. Also, if you're going to have sweet things, try and have them with your meal. So always try and have the sweet treat as a dessert with your meal. Try not to have it as a snack in between your meals. In between meals, try and have other snacks like vegetables or nuts or other things that you can have that aren't going to be too sugary. If you must have something sweet in between your meals, try and have some water or some sugarless gum or even some cheese right away after. Okay, those things are going to get rid of the acid, remove any food that's on your teeth, and prevent cavities. Okay, so that's the first one. The second one on our list there talks about retainers. So these are my favorite retainers. I like the clear removable retainer, very much like the Invisalign for the upper teeth. That's my usual one there. And then a little wire on the inside of the lower teeth. Okay, there are all sorts of different types of retainers, but for the most part, that's the ones I usually use. Just to make sure that you understand that you must hold the teeth after we've moved them. It's really important to hold the teeth in place. Okay, usually this clear one is full-time, at least 6 to 12 months, and then nights only for another year. And then I'm going to say to you, don't throw it away, keep it. You want to try it in at least once a week. If you try it in and it doesn't feel tight, the teeth haven't been moving. If it starts to feel tight, you need to wear it a bit more. Teeth can move throughout our lifetimes. There's no way of stopping that. So we need to always be aware that that needs some maintenance. Okay? That's what number 2 talks about. Number 3 talks about the roots of the teeth. So one of the things I look for on the x-ray that we've looked at together is that we have good length on all the roots of the teeth. As you move teeth around through bone, your body is reabsorbing bone to allow the tooth to move and growing new bone on the other side. The cells that do this are not specific for bone. They also change the root surface of the teeth, reabsorb the root surface, and that gets repaired just like the bone gets repaired. So the only thing that is different is that at the ends of the roots of the teeth, for some reason, instead of repairing with tooth, sometimes your body will actually repair with bone. And so that actually shortens the roots of the teeth. And for most people, this is so tiny you can't even tell on an x-ray. But for some people, it can be quite significant. It can be a third or even a half the root length, okay? So we need to screen with x-rays once a year to check for this. It's a fairly rare phenomenon, but it's really important for those people that it does happen for. Yeah. So that's what number 3 is talking about. Number 4 is talking about teeth that have had trauma. So teeth that have been hit in an accident or knocked loose, or had a big chip out of them, or even a big filling. Those teeth, the cells inside have had some trauma to them, and they're not as resilient as some of the other teeth. So when we start pushing on them, sometimes those teeth can end up getting a toothache. Okay? If that tooth starts to throb and ache differently than the others, or it's keeping you awake at night, that tooth might need a filling that goes down the root of the tooth. Okay? You can still keep the tooth, you can still move the tooth, but it might need that filling. So if that ever happens, please let us know. Okay? So that's what number 4 talks about. Number 5 is talking about the jaw joint right in here. And sometimes some people have issues with that joint where it gets sore, or they get a lot of headaches and things associated with the jaw joint. If that's flaring up for them when we're trying to move their teeth around, sometimes we have to slow down that tooth movement and let the jaw rest and heal. Okay, so please let me know if you feel like your jaw is sore, different from your teeth moving, being sore. Okay. Number 6 is talking about growth and teeth that are not erupted yet. So sometimes, depending on how the jaws are growing or the new tooth comes in, it can actually make our treatment go a little more quickly or a little more slowly. So mostly those things are really affect the length of time that you're in treatment. Number 7 is talking about things you can do to make the treatment go more quickly and more smoothly. So if you have braces on, you need to be careful not to break your appliances. If you are eating things that are very sticky or very crunchy or hard like ice, you can break the glue that's holding the braces onto the teeth. Okay? So you want to avoid those things. It doesn't mean you can't eat them. So if you want to eat an apple, you just need to slice it up thin. If caramel is your absolute most favorite thing, you can have a caramel sauce, but not the caramel candy. Okay? So just try and be really careful and aware that you don't want to put too much pressure on these braces. Okay? If you're using Invisalign, you're going to take your Invisalign off and you can eat normally. That's fine. Occasionally these little attachments that we were talking about might break off. I usually actually get you to count them all and make sure that you know if they're there. Okay? If they do happen to break off, please call us so that we can fix it for you, because we need to make sure that we're getting the right forces on those teeth. But yeah, in terms of Invisalign, in order to make this treatment keep going nice and steady and smoothly, you need to make sure you're wearing those Invisalign aligners all of the time, okay? You need to not take them out except when you're eating and cleaning your teeth. You need 20 to 22 hours a day minimum to keep those teeth moving nicely, okay? You also need to come and see us for your appointments so that we can keep things moving along. With the braces, we're going to usually see you every 4 to 6 weeks. with the Invisalign about every 6 to 8 weeks to keep things moving along. And sometimes I will have you wearing some things like elastics. So I'll just show you. You can wear these with the braces or with the Invisalign. Little elastic bands on the braces. They attach to little hooks that are here on the braces. So let me just show you how that goes, like this, that sort of thing. And they're just going to pull back on those upper teeth, forward on the lower teeth, to get those teeth to interlock nicely along the side, or however we need them to go to have those teeth fit well, okay? So if I'm asking you to do things like wear elastics, I need you to make sure that you're doing that for me. We will give you lots of packages of elastics so that you have lots of them. But they're really, really important in order to make the teeth move the way that we're hoping that they will move, in order to get the teeth to fit really nicely. And this is how you might wear them, for example, on some Invisalign. So, same sort of thing, okay? If you're having trouble wearing them, please let me know. I can figure out other ways to move the teeth, but I really need to know what's happening. If you're just telling me that you're wearing them and it's not really happening, we're going to be wasting time in the braces or in treatment and with your Invisalign that not really getting anywhere. So that definitely makes the treatment go longer, okay? So that's what number 7 talks about. Number 8 talks about teeth that are small. Sometimes we'll have you go to see the dentist. Once we get all the teeth in place, if there's a tooth that's a little too small, for example, in a certain spot, you might need some bonding or veneer to look after that with the dentist, okay? Yeah, so we'll coordinate that for you, with you. Number 9 talks about the fact that all of these things are happening in your mouth. So if you have things in your mouth, there's a risk that you might swallow something. We don't want that, of course. So we keep everything attached. But if you eat something crunchy by accident or whatever happens, and this little brace comes off the tooth, it's going to be able to slide along the wire, okay? Don't try and take it off. Call us and we'll fix it for you, okay? It's always got a little elastic or a piece of wire or something that's holding it on there. So call us so that we can fix it for you, okay? And the same, I like little rings on the back teeth with my braces, so the little ring can slip off the tooth like this a little bit. If it does, push it back onto the tooth and give us a call, okay? The other thing that can happen is that things with any appliances can be sharp or poking, right? So there can be little hooks, or the wire can shift out the back, or even with the Invisalign, there can be an edge that is catching your lip or your tongue. We don't want anything like that to be bothersome. If it's doing that, sometimes it can cause a little sore in your cheek or your lip, and little sores in your mouth can get infected. So it's really important to be careful about those little things. If you have if you have braces on your teeth, there will be wax in your kit, and you're going to just pinch off a little piece of the wax and put it over the thing that's poking you. This is good for a day or two, and sometimes given that amount of time, that's not going to rub anymore and you'll be fine. If it's still bothersome after a couple of days though, we need to see you and to smooth it out for you, okay? And the same with the Invisalign. If something is pinching or rubbing more than a day or two, we need to smooth that off for you so that it doesn't, okay? Yeah, so that's what number 9 talks about. Number 10 is talking about plans where we need to, say, take some teeth out or have jaw surgery in order to complete the treatment. I don't do those things. Other people will do them for you. They will discuss the risks associated with those treatments with you. Generally, their major ones are to do with bleeding and infection, which are really uncommon in a healthy person. That's what that's talking about. Number 11 is talking about these clear braces specifically. The clear braces work exactly the same way that the metal braces do. They are exactly the same in terms of how they move the teeth. The clear braces, though, are made out of porcelain, And the porcelain is a little bit brittle. So sometimes if you've eaten something crunchy, instead of the whole brace coming off of the tooth, you can chip a little piece off. I can't keep that tied to the wire, so you could swallow it, but it's so tiny, I don't think it's really going to hurt you, and we just might have to repair the braces. So I do ask that you be a little bit extra careful with these clear braces. They're a little more delicate. The other thing about them is where the upper teeth reach over the lower teeth, if they start rubbing on that brace, it can cause wear on the upper teeth. So we always prop the bite open a little bit so that it's not going to rub there. But if during the time in between appointments the teeth are moving around and it starts to rub somewhere, please come and show us so that we can make sure that it doesn't do that and cause wear on the teeth. Okay, that's those ones. And then the last thing there says that if anything changes in your medical history, to please let us know. If you become allergic to something or start taking some medicine or something, we need to know. There's very few things that interfere with our treatment, but they're very important if it happens to be one of those things. So please let us know if those medical history changes. So this list that I've gone over is our standard list. It is a list that applies to virtually anyone having orthodontic treatment. There are sometimes particular risks for different aspects of treatment, and if those apply to you, we will go over them specifically with you at the time. So thanks for your attention. I hope this was helpful.